Welcome to From the Floor. As we navigated the floors, the exhibit halls at both ViVE and HIMSS 2024 conferences, it became clear that despite the ever-evolving challenges in healthcare IT, ranging from travel restrictions to cybersecurity incidents like Change Healthcare, there remains an unwavering commitment to innovation and advancement in healthcare solutions. Our mission, to bring you the essence of these conferences, showcase what you might have missed. Through engaging with exhibitors, we delve into the problems that they aim to solve within the healthcare sector and the innovative solutions they offer. And now, from the floor.
Hey everyone, Samuel here from the floor at ViVE 2024. I'm here with Adnan Iqbal. He's the co-founder and CEO of Luma Health. Adnan, thanks for being here. How's the show been for you?
Awesome. I mean, one, it's in Los Angeles, so great city to be in.
Yeah.
And like the energy here is excellent. And
Yeah.
we've had a chance to hang with chief information officers, CIOs, our customers, as well as a number of leading health systems across the country. And so people are looking to solve real problems, and that's a great conference when people are looking to solve real problems.
So you guys, I know, are doing some very interesting things around how patients and hospitals engage with all of the information that exists. Why don't you tell us a little bit about what Luma Health is doing?
Absolutely. No, you use the word engage. I hate the word engage.
Okay.
None of us want to be engaged with, right?
Okay.
We want to be helped and get to like our outcome. And so I think we've seen people go from wanting messaging to patient engagement to digital front door. And really what we're seeing now is people want an end-to-end consumer journey platform. And so that's our superpower. You have every health system, clinic network has their core systems of truth, the electronic health record, CRM, call center, payments and revenue cycle. And we sit on top and help you orchestrate the entire consumer or patient journey. So depth of integration, access and operational, clinical, and financial, so the entire consumer journey.
So you're making it easier basically for patients to get the care that they need.
Absolutely.
And for systems to deliver that care.
Absolutely.
How is that, like, what is it changing for hospitals that you guys work with?
Yeah, I mean, we know hospitals and healthcare want to do the right thing, right? They want to deliver an A+ product, get the best doctors, the best technology, but if you can't solve for access, you never get to do that. So one is equitable access, right? Real-time, automated, text first, like no app, no download. 40 languages out of the box, so it's truly a solution for 100% of Americans, right? So get them in, and then all of us are guilty of not being great patients, right, at times. So how do you nudge people effectively before, during, between, after, to stay on the right clinical journey? And then most importantly, I think, especially in the world we're in today, is we're all paying for more and more of our healthcare, right? So how do you help people who are making a healthcare decision, not just based on healthcare need, but cost, convenience, and then need, have a true shop-click-pay experience, right? So access and operational, clinical, and financial, like that's the power of it.
Yeah, so you got to bring it all together, making life easier across the wide spectrum.
Absolutely.
People who care about it.
And that's great for patients, but it's also great for staff.
Yeah.
Right, because staff like don't want to be clicking around in 10 different systems. Everyone says the same thing, and it's like, but is this really automating my workflow? And so that's the power of like those deep hooks we have into all those systems of record, that no one has to be switching around, like it's just happening and it's magic, right? And the workflows are truly automated for staff.
That's wonderful. What are some of the conversations you're having with people here at ViVE? What are some of the main trends and themes that you're seeing?
Yeah, so we're hearing from a lot of CIOs, access leaders, transformation leaders, revenue cycle and marketing leaders as well. It's like, hey, access is critical, right? In a world where we are looking to not just acquire customers and patients, but also retain them, and then make sure that they get more and more needed healthcare in an environment that's increasingly competitive. We have to think about our digital strategy, not as just like a nice to have, but as a must have. I think Jeff Johnson at Banner Health articulates it perfectly. He's like, we have to move from being a health system that engages in digital interactions to being a digital first organization that delivers care to our customers and their families. So a real powerful mind shift, and we're seeing that echo across the event here. And people are not just talking about it, they're looking for real solutions to real challenges, right? Everyone acknowledges workforce is a challenge, automation is a need, AI is a buzzword, right? But folks are like, hey, we got to solve real problems in the environment that we're in, which is we're capital constrained, and people, all of us have more choice.
Well, it's interesting because this is a conversation, as you know, in the healthcare space, it's been happening for a long time. How do we better serve across the life cycle? So it's good to hear that action is being taken and they're ready to start doing something real about it. So
Absolutely. And the last one I'd say is, what's been a buzzword for a long time is value-based care. I think we're finally seeing that it's real, right? And we're seeing that people are thinking very purposefully about what are the technology investments I need to make today to be able to have a true value-based outcome for a consumer or patient, and do that over the lifetime of that patient's journey. Right? And so that's making them think very critically about what are the systems of record and tools we have today, and how do we take a true integrated digital strategy approach as opposed to like bits and bobs.
Yes.
Which is great.
That's wonderful.
Yeah.
Well, it's awesome to have you here. Thanks for being with us
Thank
today.
you so much for hanging out.
Yeah, and that's all for now.
I love these episodes. What an inspiring array of healthcare partners we've had the privilege to interact with at these conferences. A huge thank you to all the individuals and teams who took the time to share their visions and solutions with us at ViVE and HIMSS 2024. Conversations like these reinforce our commitment to transform the healthcare IT community one connection at a time. Thanks for listening. That's all for now.